everybody. Good afternoon. So, I want to discuss aspirin. You will have seen, my followers, that I've done a couple of posts on aspirin over the last 2 days that have got a lot of interaction. Thank you for that. Basically, touting the benefit of aspirin, which I only shared a handful of studies. There's a lot more. The benefits of aspirin is going back hundreds of years. Aspirin being salicylic acid, which is originally derived from the white willow bark tree. But some of the comments on the posts were a little bit of concern about blood thinning, and one particular one was about stomach bleeding, and that's what I wanted to address here. There's been a lot of fear-mongering, I'm going to call it fear-mongering, around the use of aspirin from the pharmaceutical industry. We could argue over why they have suppressed this molecule so much from us, this molecule that mountains of research shows us many benefits, from improving thyroid and metabolism to offsetting the damaging effects of estrogen, to reducing inflammation, helping prevent Alzheimer's, Parkinson's, upregulate progesterone and progesterone receptors, and we could go on and on and on. Gallbladder, liver issues, kidney issues. Anyway, one can wonder why it was suppressed so much, and many of us will agree that the pharmaceutical industry doesn't always have our best interests at heart. Regardless, back to the question at hand was, well, what about aspirin causing stomach bleeding? And it's curious that people think aspirin causes stomach bleeding. There's lots of things that cause stomach bleeding. But when you look at the research, it's quite interesting what you'll find. So when we look at the research, a lot of the research around aspirin and stomach bleeding is done in the older population, 60 and 70 years and older. Actually, a lot of them done, or several of them are done in participants aged 70 years and older. So right away there, well, this is an older population. We don't know what their lives looked like, what other medications they've been exposed to, what their diet was like over the years. Did they abuse alcohol? Did they have a lot of stress in their life? Were they exposed to any other illnesses or pathogens on traveling? Is there genetic issues there? Like, we don't know. Wear and tear, like they're 70 and older. That has to be considered. So when we look further though at the research, it gets a bit more interesting. So one such clinical trial, which was done in 2021, it's pretty recent, and you'll find it in BMJ. It's titled Major GI Bleeding in Older Persons Using Aspirin, Incidence and Risk Factors. Risk factors being important there. And basically what we see in this, that aspirin can increase the risk. So there was 19,114 participants aged 70 years and older, which is quite a nice number of participants, and they did see that there was an increase in gastrointestinal bleeding in this trial, even at low doses. Again, these are 70 years and older. Their system is going to be weaker, and we'll look at that a little bit more. There were previous studies that have demonstrated there was a link between the occurrence of peptic ulcers in patients receiving low-dose aspirin, except these patients already had Helicobacter pylori, or H. pylori, which is a bacteria or a pathogen that infects and drills into the stomach lining and exposes the stomach lining and causes blisters and the whole lot within the stomach, and not just the stomach, in the duodenum as well. So you've got your stomach, duodenum, small intestine, large intestine. So this study you'll find on PubMed, not too old, December 2018, Helicobacter pylori and low-dose aspirin ulcer risk. These participants already had H. pylori. H. pylori, as is well known through the health and medical industry, is the main driver of stomach ulcers or peptic ulcers. And as we continue to look at the research, we start to see that, hold on, these people that have H. pylori, they seem to have increased bleeding from aspirin because the H. pylori is causing the ulcers, but it's also causing a lot of inflammation in the stomach. And they also have lower stomach acid, so lower hydrochloric acid, which is your number one defense against H. pylori and other pathogens that can come into your stomach. So we already have H. pylori causing a stomach ulcer. We have exposure to the tissue there because of both of these issues. We also have lower hydrochloric acid, and you need hydrochloric acid to maintain a healthy stomach and break down any supplement, medication, food, anything that comes into your system. So now we're starting to connect the dots here. So what the research really is saying, that if there is already stomach damage, tissue damage in the stomach lining from H. pylori, which drills into the stomach lining and causes the tissue to be inflamed and exposed and very sensitive. If we already have stomach ulcers, if we already have inflammation of the stomach lining, if we already have low hydrochloric acid, if for whatever reason the stomach is already at risk, while I'm on it, why would someone have low stomach acid? Well, abuse of their body, excess consumption of polyunsaturated fatty acids, processed foods, deep fried foods, alcohol abuse, stress. Stress will cause, I think most people know, stress will cause a reduction in hydrochloric acid because stress pulls blood away from the digestive system. That slows down the production of hydrochloric acid and digestive enzymes and bile acids and the whole lot. So now you're lowering hydrochloric acid. If you lower hydrochloric acid and somehow you take a drink out of a dirty glass and that glass has a bad bacteria on it, like H. pylori, in normal circumstances, that very, very acidic stuff is supposed to kill that pathogen. But if you have low stomach acid, now you've nothing to kill that pathogen. And now that pathogen goes and has a heyday and implants itself in your stomach lining and drills in there, because when you look at H. pylori under a microscope, it has a tail that looks like a screw and it drills right into your stomach lining. Then you end up getting exposed tissue and ulcers, like I mentioned. Then you also have wear and tear as well. A lot of elderly people have inflammation in their stomach. They have issues digesting because of wear and tear, whatever their nutrition and lifestyle practices were over their lifetime, whatever stress they had, the water they drank, whether or not they had good sleep. There's a lot to be considered. But what is pretty solid is that those that were at higher risk of stomach bleeding from aspirin already had the stomach damage. And if we look further, if we continue to look further at the research, that we see not only does H. pylori and stomach ulcers cause bleeding in themselves, regardless of aspirin being present or not, what we do see is that if we remove or address the H. pylori, if there's eradication of the H. pylori, and healing of the stomach and healing of the stomach ulcer and improving the gastrointestinal lining and that mucus lining that protects your stomach wall. If we do all of that, then there's a huge reduction, if not no chance of gastrointestinal bleeding from aspirin. So another such study there was done, and this one basically said, and you'll find this in the Lancet, it was a large randomized trial, and it was used to address the issue of H. pylori eradication to prevent aspirin-related gastrointestinal bleeding. And what they saw, lo and behold, was that when you eradicated H. pylori, you then saw a reduction in gastrointestinal bleeding. So, in summary, this tells us that the people who already have stomach lining damage, which a lot of people have, I will admit a lot of people do have for many, many reasons, they're at a higher risk of stomach bleeding while taking aspirin, but it's not necessarily because of the aspirin. It's because there's already damage there, and you won't know what the damage is unless you do some sort of endoscopy or get some sort of examination done where you can get a diagnosis of what's going on there. I would strongly say that most people have low stomach acid. If you've got acid reflux, you have low stomach acid. Most people experience this. If you've got any stress in your life at all, most people have low stomach acid. So we'll discuss what you can do. But it does appear very much that when we reduce the damage or improve the damage, eradicate these pathogens, then we see that there is a lower likelihood of stomach bleeding, but also reducing inflammation overall, which was also reduction in inflammatory prostaglandins. Prostaglandins are like an inflammatory molecule, and the body will make them depending on what food you're exposed to. But really, when we look at polyunsaturated fatty acids, greasy foods, foods that are high in fat and sugar together, cheesecake, for example, even pizza. But regardless, when we reduce those foods, that can help reduce the inflammation in the stomach as well. So there is a lot to be considered, and I'll go back to the people I work with generally are between their mid-20s to 70s. I know it's quite a broad range, but I'd say the majority of my clients are in their mid-30s to early 50s. They're not in this over 70 age group. They are being more proactive on their diet. There is some stuff to be considered. But I will agree, a lot of people have a lot of stomach issues. They do. It's just almost the nature of the game of being alive in 2024. So what can we do? Well, one of my favorite supplements, mastic gum. Amazing for healing the stomach lining, for killing H. pylori, for improving the immune system and the microbiome. I love H. pylori. It's anti-inflammatory in the stomach. We can pair it with marshmallow root or marshmallow tea to help with that mucilaginous coating in the stomach. So you can take mastic gum. If you're taking aspirin and you're concerned, you would also take mastic gum as well. Another thing is enteric coated or uncoated. I haven't seen many places doing uncoated aspirin, but really you want enteric coated. Enteric coated just means that the aspirin cannot be broken down fully in the stomach. It's going to get broken down in the small intestine. When it comes to absorbing nutrients and different molecules, that happens in the small intestine. It gets broken down in the small intestine and then enters the bloodstream that way and goes wherever it's going. So enteric coating is another thing. Also, taking your aspirin with food. Because when you take your aspirin with food, the aspirin then gets bound up in the food and moves on to the duodenum and then into the small intestine. The aspirin is not being absorbed through the stomach wall or lining. So there are a couple of things you can do. at a low dose, the research is really prominent in more than 100 milligrams. Low dose or baby aspirin is 81 milligrams, so pretty low. So if you were still concerned after taking your aspirin with food and using enteric coating and maybe even using mastic gum as well, if you were still concerned, you could do it every other day too. But really what I'm reading from the research is that people that may be at risk from stomach bleeding, and that's a small maybe, are people who already have stomach damage and people over 70. Also, when we're looking at taking aspirin, it's obviously going to be individual. Have a practitioner that you're talking to or you're working with. But aspirin is prescribed daily by doctors in and out of the hospital, general practitioners, OBGYNs. Aspirin is well known in the medical industry to have an abundance of benefits. It will get prescribed to people not in their 70s, in their 40s, 50s, to take a daily baby aspirin every morning to help with the prevention or help prevent blood clotting, cardiovascular issues, the risk of disease. There are even some medical practices that will prescribe aspirin to help with diabetes and the likes of Alzheimer's. There are many hospitals and practitioners and OBGYNs, gynecologists that will recommend that they're pregnant ladies who we would all agree are more vulnerable than the rest of us during pregnancy. They get recommended to take baby aspirins every day during their pregnancy to help offset preeclampsia and other blood pressure issues, even gestational diabetes. So if they're recommending this to other people, if they're recommending this to women who are pregnant, and we know that women who consume anything during pregnancy, it does go through the placenta to the baby. And if these specialists are not concerned about the risk of aspirin going into a fetus, it really makes you wonder. We've known for hundreds of years the benefits of aspirin. Aspirin can't be patented. Aspirin is very, very affordable. Not to get my conspiracy hat on, but it would make you wonder why the pharmaceutical companies suppressed this from us when the research is abundant on its benefits and when specialists are recommending it to certain categories of people and pregnant people, knowing well that it will cross into the placenta, and they're not worried. So, in my opinion, do you have a health practitioner that you can consult with and get their opinion and look at the circumstances if you're concerned about this? Otherwise, get enteric coated, try it for 2 weeks, take it with your breakfast. At the very least, see how you feel after 2 weeks. A lot of the research is longer than 2 weeks. It's long term. So by 2 weeks, you can tell if you're feeling good, if you're not feeling good, if your inflammation has subsided, if your period was lighter. I haven't had a migraine, and I normally have daily migraines. Most people know their body pretty well, so you can tell. But that's the situation on aspirin, stomach bleeding, enteric coated, uncoated. Again, I haven't seen many places that don't have it coated. I get the feeling that they may have discontinued that to reduce risk. Maybe people were not purchasing it. And then there is, before I let you go, there is the question around blood thinning. Aspirin is a blood thinner. So is krill oil, so is omega-3, so is resveratrol, so is green tea, so is dark chocolate, so is blueberries, so are apples, so is vitamin D, vitamin C. Like, most healthy food is blood thinning. When we look at longevity and optimal health outcomes, we want to have thin blood. sticky, clotty, gluggy blood, inflamed blood, because that's what it is. A blood clot is inflamed blood. It's blood that moves through your veins and your system like sludge. We don't want that. That is, well, it's a key factor in aging. I have a podcast episode on this called Inflammaging. This is literally the key factor. Inflamed blood, which a lot of people don't give a lot of consideration to, but yes, your blood can become inflamed, and that's where you have a lot of blood clots. Think of a heavy bleed and you get a lot of blood clots there. That is inflamed blood. The ideal situation for longevity and anti-aging is to have thin, beautiful, viscous blood that flows easy and is not causing problems anywhere. Thick, gluggy blood, estrogen dominant blood, that's a problem. Think of all the symptoms and issues you have with estrogen dominance. We want our blood thin and moving very nice and flowing well. There are a subcategory of people who, when they take aspirin, their blood is already thin. Generally the constitution of that person is thin, like their capillaries in their nasal cavity and nose are thin. Their blood vessels can be thinner. This is a genetic trait. Most people that have this know what's an issue and what's not. They grew up with a lot of nosebleeds throughout their life. If they take aspirin, they will get a nosebleed, and then they'll stop it and it's generally fine after that. That's a small category people. Those people generally know, and that's not so much thin blood as it is the capillaries and the tissues are weaker. So yeah, that's really the consideration around blood thinners. I cannot stress it enough. Vitamin K2, if you're not taking a vitamin K2 supplement, you also get vitamin K2 in animal foods, especially chicken thighs. There's like most healthy food, that's why it's healthy. That's why it's anti-inflammatory, it's anti-aging, it's good for you because it thins the blood and it reduces inflammation. So I hope that answers people's concerns and questions around aspirin. I personally, this is not medical advice. This is just my understanding from the research. This is what I am doing. I'm personally taking a baby aspirin for 2 weeks to see how I feel. I'm also off to Arizona for a week. And from the research, it's my understanding that a baby aspirin taken daily can protect you against polyunsaturated fatty acids, these PUFAs, these lipopolysaccharides, and prostaglandins that can be made in the body, can occur in the body when you consume like our takeout, our treats, our cakes. Cheesecake was an example. I'm not a big cheesecake person, but I know we are going to try some restaurants and it's our vacation. I'm obviously going to stack conditions in my favor because that's the type of person I am. But I'm curious to see if aspirin is going to protect me against exposure to some of these molecules. I generally don't eat deep fried food or a lot of stuff like that. I don't drink frappuccinos. I rarely have pizza. I rarely have like a burger with cheese. But I will have a cocktail or two. We will be going for Mexican. My little boy wants to try some churros and a donut store. So I will be getting exposed to some more like inflammatory molecules. And from the research, it seems to show that actually aspirin can be very protective against these molecules and reducing the onset of lipopolysaccharides, which are super inflammatory and damaging in the body. So I'll keep you guys updated, but that's what I'm personally doing. I'm not concerned. Of course, I'm going to listen to my body. If I see any abnormalities that I assume are going to be aspirin, because really it's the only change I'm making this week, then I will stop it immediately. So yeah, I hope that was helpful. I hope it answered your questions. If you've got any more, put them in the comments. I am happy to answer. I will also post the links to the research in the comments. Okay, bye-bye.